thanks to SIRC for hosting this important conference and inviting me to contribute. I suspect a lot of you are familiar with the training, and for those who aren't, it's an online e-learning module. It's been in place for 10 years now, and it's been now taken over 170,000 times, with an annual completion of over 30,000 just last year alone. So really happy and excited with those numbers. Our goal is to address a lot of what was brought up, I think, during this morning's session, really to help the competence and confidence of coaches in understanding, recognizing, and supporting the management of concussions in sport. It's vital for us to ensure that coaches are armed with the latest information and resources that are that are consistent with our Canadian partners. And this is why the Coaching Association of Canada has been certainly an active member of the FPT work group on concussions in sport, just to stay up to speed, understand how we can support coaches across the system. And the launch of the new international consensus statement on concussion in sport has certainly driven us to make appropriate revisions to our module. And we're really grateful for to come together in collaboration with Dr. Catherine Schneider in particular, but also Dr. Pierre Fremont, Dr. Roger Zemek, Dr. Paul Eliason, and Stephanie Cowell with Parachute Canada, who are all speaking as part of the conference today, as well as a lot of other experts across the system, just to ensure we're providing the best possible information for coaches. A priority for us is system alignment. So we want to collaborate with partners to ensure that our programming is aligned and complementary with other resources that support this important work across the system. So we've been working really closely to ensure that the messaging for coaches is the same they'll hear from other system leaders and medical professionals alike. While we're right kind of smack in the middle of our revision process, we're very excited with what's to come. What you can expect from NCCP making headway is definitely a few more small tweaks to ensure processes are aligned with the latest research-based evidences, affecting the return to sport strategies, like the benefits of, as Catherine just mentioned, system-tolerated physical activity and aerobic exercise treatment as early interventions. But we're also making a few larger revisions, including updated animated videos, expert videos, and certainly a bigger shift to embed the CRT6 within our training. Again, the goal being that coaches are familiar and feel comfortable utilizing this tool as their go-to resource to help kind of identify immediate responses, as well as potential, concussions, and recognizing potential concussions. And again, building their confidence to remove participants when corresponding signs and symptoms of a potential concussion are present. Another really big change that we're excited about is enhancing our efforts to support prevention interventions that Dr. Eliason spoke to this morning. Most specifically, as Catherine also mentioned, neuromuscular training in warm-ups. We're very excited about the research that's demonstrated that including kind of certain neuromuscular training exercises can help minimize the potential for concussions in sport. And these example exercises will certainly be kind of embedded within the training, providing much needed practical tools to help coaches take a more proactive approach to concussion prevention. And with these changes, we'll certainly be promoting or heavily promoting the value for all coaches across the country to take the revised NCCP Making Headway e-learning module, which we are targeting for a launch May 2024. That's it from me. Thanks again.
May 2024 is the date we'll be looking out for the new NCCP Making Headway module, a great tool for all coaches, for anyone really who's involved in sport and youth athletes, any athletes. Up next, we have Pierre Fremont, who will be talking to you about the MOOC, the Massive Open Online Course on Concussion.
Over to you, Pierre. So I'm speaking today on behalf of my partner in crime, Catherine Schneider, who helped develop this massive open online course. Okay, so in terms of disclosure, just regarding the MOOC, this was developed as part of our respective academic work. So we don't get paid for this. We don't make a profit on this. The MOOC is free, except for an administrative cost for those who want to obtain an optional certificate of achievement. And all the funds obtained from this administrative cost is dedicated to the resources required to update for the updates of the course. So what is the MOOC? So you may already be aware that MOOC stands for Massive Open Online Course. And the objective of this course is not only to develop an understanding of concussion, it's also to implement evidence-informed principles for prevention, detection, and management, which basically covers what Catherine summarized from the Amsterdam Consensus. Then it's to help the broad spectrum of participants that I'll describe later to let everyone know what they can do about concussion, whoever they are. It's also, there's a whole component which is designed to support the work of properly adapting a protocol for the characteristics of any given sport and the resources that you can have at different level of participation. All level of participation don't have the resources that you can find on a national team. So one of the role of the MOOC is to try to reach down towards grassroots sports and support everyone in the process of implementing protocols. Also, there's a side of the MOOC dedicated to the identification of the strategies to revise and update the protocol on an iterative basis, namely when there is a major update of the recommendations. So the MOOC is based on a framework initially published by the Canadian Concussion Collaborative that suggests that a good protocol should address prevention, optimize detection, define and implement a standardized initial management, then identify trajectories of care when concussion do not resolve spontaneously with the initial standardized care, and finally how to implement, evaluate, update, and make your protocol better from the evolution of science and learned experience. So the MOOC is built with 6 sections, an introduction, and 5 modules dedicated to each of those 5 bubbles. This is the typical structure of one module. You have a screenshot of the prevention module here. So there's a first element called main content that includes a column on the left, which is called basic notions, and a column on the right, which is called expert capsules, where we go more deeply into more focused aspects of the topic being discussed. And basic notions will basically cover the key recommendation from the consensus in the case of our next edition. Then you have another tab called protocol, where we provide a practical example, lived experience from different stakeholders that we interview, and then support a reflective process for participants who set for themselves an objective of updating or implementing a protocol. This is also, every module is linked to a discussion forum where we have discussion between a broad spectrum of participants. It's very rich. You can have the lived experience, and then you have comments from healthcare providers, decision makers, coaching staff, and so on, all interacting on the same topic. It's a lot of fun to manage that forum. And then formal evaluation that can lead to a certificate of achievement for participants who can reach the pass mark, and they have 3 chances to improve their mark on each of the modules. So it has a formative aspect to it that we feel strongly about. This is data about the actual success rate. So successful completion was this is data for about 8,600 participants from actually 12,700 participants from the first 2 editions of the English MOOC. And the overall successful participation rate was 33%, which is very high compared to the published similar figure for several other MOOCs in public health. And if we only look at those who actually started to participate, not only registered, but those who access for the first to the first module to initiate participation, almost 60% of those successfully completed. So very good numbers in terms of engagement of the participants. So who is the MOOC intended for? So it's for every categories of stakeholder you can think of. The most represented category being healthcare providers other than physician. So we had a lot of physiotherapists, chiropractors, athletic therapists, and so on that from their participation in the forums were highly involved in sport environments, so have the potential to play a central role in the implementation of protocols. So how can you access the MOOC? So basically, it's just we're very close to the launch of the MOOC that we call 2.0, which will reflect the new Amsterdam Consensus on March 11th. Registration is now open. So this is the link where you can reach the registration page. But I also just added that you don't have the QR code in the handout, but this is a QR code that will get you directly to the University of Calgary information page about the MOOC, which will lead you to the registration page if you want to register for the MOOC. And the French language MOOC is being updated, but we are waiting for the translation of the key tools from the consensus and some other French tools developed in Quebec to launch this one in the fall of this year. So that's what I wanted to cover for the MOOC. Thank you very much.
Merci beaucoup, Pierre. That was amazing. And if you haven't checked out the MOOC, I encourage you to do so. Okay, up next, we have Shelina Babul, who's going to be talking about the Concussion Awareness Training Tool, what we commonly know as the CAT.
Excellent. Shelina, you are next. You have 5 minutes.
Thank you for having me, and I'm pleased to speak to you about the Concussion Awareness Training Tool. As you can, as you've heard from today, there's a wealth of resource that's out there when it comes to concussion knowledge, awareness, and tools. And we've really come a long way in breaking the silos across the country and working together to harmonize efforts. So today, I just want to highlight the CAT tool, talk about what it is briefly, who is it for, and how you can access it. So what is the Concussion Awareness Training Tool? It was really built over a decade ago to really address a gap in knowledge amongst various audiences. Depending on who you are, what you need to know is very different. And we've got amazing research being done in various areas such as blood biomarkers, neuroimaging, such as some of the highlights that Dr. Zemek highlighted earlier today. But at the ground level right now, immediate recognition is really pivotal to recovery. So I started getting more and more calls in my office from people saying, who do I go? Where do I go? No one believes my son or daughter can't function in the school setting. The doctor said he's had his bell rung. So we really recognized that there was a gap in what people knew and understood about concussions. So what we did at that time around 2011, 2012, was we did an in-depth environmental scan to say, what exists out there? Is there any tool that exists to inform various audiences? And there was only a few, and those that existed at the time had a cost attached to it. So what we did after that, we did the scan, we conducted focus groups with the various audiences because depending on who you are, what you need to know is very different. So we asked a variety of questions in these focus groups. So physicians said to us, we're very busy. Tell us what we need to know, short and sweet. Parents said, if I go to Dr. Google, I'll get millions of hits. How do I know what's credible, what's the best evidence out there versus a blog that someone's written? So we took all that information and we developed the CAT tool, the Concussion Awareness Training Tool. So it really is an educational tool with relevant resources to specific audiences. So each module has an e-learning course for that audience and then curated relevant evidence-based resources for that audience. Initially, we were building it because it was funded by our British Columbia Ministry of Health. We were building it with a BC lens, but then quickly recognized, and from the focus groups, that how we recognize, diagnose, treat, and manage concussions in BC should be no different than how you do it across the country or globally for that matter. So we really tried to keep it generalizable to a global lens. It's built on the learner-centered model as people like to learn by different modalities. Some like to read, some like to watch, some like to listen. So we incorporated all that information. It is evidence-based. It's based on peer-reviewed evidence, and we did not and do not reinvent the wheel when credible evidence exists in certain resources. We just add that to the tool. So it really is a one-stop shop for all the resources that you need. It's reviewed and updated quarterly to add relevant publications, new resources that may exist, and to fix broken links, because I know if I go to a website and I get the spinning wheel, I probably won't go back there again. So we want to make sure it's up to date. All 8 modules have been evaluated and showed statistical significance for changing knowledge, behaviors, and attitudes and practice. Because a lot of money had gone into developing the CAT tool, and we wanted to make sure that it was money well spent, that it was making a difference. It's available 24/7. It's free of charge because our government said we don't want to charge individuals. We want them to know about this. We want them to gain an understanding and education, so we want it to be free. And those that take the e-learning modules get a certificate upon completion. And for those organizations, sporting associations, universities, colleges that mandate it, they automatically get a certification of completion from that individual as well. So just to highlight, the image on the left is what the site currently looks like. You can see it's got the 8 icons, personas, and depending on who you are, you click on that and it takes you to the page that's curated for that audience. The image on the right is just a sneak preview of the new version that will be launched in April of this year. It's going to have updated features because we really rely heavily on the feedback we receive. So we want to always ensure that we are listening and updating the site accordingly. So who is it intended for? When we first built it, we built it for medical professionals, coaches, and parents. And as you can see here, through the last decade, and based on what users wanted, we've expanded it to 8 modules, and we've highlighted the dates there that they have been updated. It's recognized provincially, nationally, and internationally. And as I said, it's been mandated by schools, sporting associations, 36 of the universities and colleges across the country. So we've really been very happy with the uptake. Just to highlight some pages on the site, we have a resource page where you can select your parameters on the right-hand side, and it automatically updates the relevant resources that you are looking for on the left-hand side with the dates attached to it. So it makes it a lot user-friendly for someone who's looking for a specific resource. We've taken the consensus guidelines and recommendations, and we've updated all our return strategies with more in-depth information, because that's what we hear from users is tell us a bit more. Tell us what we can and can't do, how we progress, how we regress. So we have all those updated as well on the site currently. People said to us, we want packages that we can keep in our office, on our desk, in the kitchen, with all the relevant resources we need if we don't have access to a computer. So we built these packages with all the relevant resources. And for instance, in the parents and caregivers, we've got a questions to ask your doctor with a perforated page. And the reason we built that, because we know the gaps that exist in our healthcare system. So if your doctor can't answer some of these questions, you probably want to get a second opinion. So we do have these packages as well. And just to really quickly show you some of the knowledge translation strategies, as you can see, it's been mandated in over 100 organizations and schools across the country. We get about under 30,000 visits per month, and we stopped updating this actually, and we've just added plus signs because we found we were constantly updating the numbers. So I think we're currently at 160 or 170,000 completions of the course. And to give you an idea from a global perspective, you can see here that it's been utilized in 209 countries with the course mandates and with over 2 million visits to the site. Just really quickly to highlight our social marketing campaigns in our province, we've got billboards in all the major arteries across our province, highlighting the CAT and knowledge around concussion. We had ads put in the buses as well, and we also had it highlighted at our Vancouver Canadian sporting event. And what we saw is based on all these activities, we saw quite an increase in usage of the CAT site. And you can see here that we have taken the CAT internationally. We've done workshops in East Africa, in South Africa, in Lebanon, Beirut, which has led to mandating of the CAT amongst school professionals in Beirut. It's taught in the medical school in Japan, and UBC is the first medical school across the country that has put a mandatory CAT completion for fourth-year medical students, as well as a concussion-specific lecture that is given. So future directions, we will be launching the new platform, the new site with all the updated e-learning modules in the spring of this year. We're going to try and engage more with rural and remote communities because that's a major gap. We are going to include parasport and athletes with disability resources to the site because that's another gap, and working with Indigenous peoples across the province to incorporate resources specific to them, because when you talk about pain and headaches, that means something very different to Indigenous people when you talk about symptoms. So we're really working with them to see what resonates with them. So how can you access it? It's at catonline.com, cattonline.com, and we also have social media presence, which highlights it as well. And I'm happy to answer any questions you may have via email at any time. So thank you for the opportunity to present today.
Thank you, Shelina, for joining us today. All right, our next presenter, Jenny Dawson, is here to talk to us about a really cool new tool, the Pediatric Living Guidelines.
All right, over to you, Jenny, for your 5-minute presentation.
As you mentioned, my name is Jenny Dawson, and I work at the Children's Hospital of Eastern Ontario. There have been many advances, as we've been learning about today, in concussion research. And a lot of them are really exciting and have the ability to actually improve outcomes for kids with concussion. The main focus of my work at CHEO is to ensure that the high quality research gets into clinical practice right away, so that kids get the best possible care when they need it. And my project is called the Living Guideline for Pediatric Concussion Care. The project co-leads are Dr. Roger Zemek, who you heard from earlier today, talking about some of the research that we also do, and Dr. Nick Reed from the University of Toronto, who is presenting, I believe, in one of the breakout rooms later on this afternoon. So what is the Living Guideline? The Living Guideline is housed on a website, pedsconcussion.com. And on this website, there are many different resources for healthcare professionals, including over 80 clinical recommendations that help professionals treat kids with concussion. The thing that's different about this project is that every 6 months, all of the clinical recommendations and clinical tools and resources on this website are reviewed along with the new evidence from trials. That means that the guidance in this project is always up to date and reflects the latest in both evidence-based care and expert consensus. So how do we do this? I apologize, this is a very busy slide. I mentioned the project leads are from CHEO, the University of Ottawa, and the University of Toronto. Along with those leads, there are over 48 of the top concussion researchers from across North America who volunteer in the background on this project. These are the experts who review new research findings and vote on all of the changes to clinical care. We heard from Dr. Schneider, Dr. Babul, Dr. Fremont just now. Those are actually 3 of the experts on our panel as well. We feel really fortunate to work with these experts, and it means that we can really feel confident that all the angles have been covered and our updates accurately reflect the latest knowledge. So the goal of this project is to ensure that everyone has access to up-to-date and evidence-based care, and that can be standardized. In just the past few years, and as we've just learned from the presentations by Catherine on the 6th, and what's going to be coming out in the Canadian consensus, we've completely changed how concussion is managed. An example is our greater understanding of the role of aerobic exercise. How to safely return to sports in school is really important, and accurately communicating that is important. So on our website, we share bilingual resources. We have a large focus on mobilizing the information. Quite a few people do use the guidelines. We've had over 100,000 views in the past couple of years and uses from 134 countries. So we really have national reach. Users range from healthcare professionals, students, teachers, coaches, and also policymakers. I won't go through this. This is an example of one of the alerts we put out in the fall when we were able to incorporate and harmonize with the 6th and also include new evidence. So for example, on returning to school, the role of screen time, we learned about that a little bit earlier, finding a balance, and also updating our documents to include the tools from the 6th consensus in sport. So once again, I encourage you to check out the website where all of this information is shared. Other activities include publishing in peer-reviewed medical journals. We're trying our best to make change and make sure that all healthcare professionals and families know and understand these updates. In summary, I encourage you to check out our website. You'll find all the tools and all the updates there. It's pedsconcussion.com. And thank you, SIRC, for the opportunity to share our project. I look forward to continue learning from the other speakers.
Alex Lithopoulos, you are next. We can't wait to hear about the adult living guidelines this time. So Alex, over to you for your 5 minutes of fame.
Thank you very much. So I'm Alex Lithopoulos. I'm one of the researchers working at the Ottawa Hospital Research Institute on the Living Concussion Guidelines for Adults. I'd like to acknowledge Dr. Sean Marshall, who's a physiatrist at the Ottawa Hospital, and he's been the project leader for this project since about 2007 or 8. We also have a small team of research associates and also an executive committee that looks over all of our major decisions. And I also want to acknowledge our financial support, which comes mainly from the Ontario Ministry of Health and also from the University of Ottawa Brain and Mind Research Institute. Okay, so just briefly, why are we even working on this project? Well, we know that concussion can result in quite concerning symptoms, and unfortunately, about 15 to 20% of adults also experience prolonged symptoms. And we also know that early diagnosis and early proper treatment have been shown to lead to speeded recovery, which means that healthcare providers and patients require the most up-to-date guidance on diagnosis, recognition, and assessment, and also initial management and management of prolonged symptoms. And we also know that over the last couple of decades that concussion research, especially in the adult domain, has been increasing exponentially, really. Therefore, it made sense to create a guideline, a set of recommendations for the management of concussion in adults that is updated continuously. Okay, like I said, we created what we're calling the Living Concussion Guidelines, and we provide evidence-based recommendations for healthcare providers. And we also provide resources to healthcare providers and patients. So just quickly, a little bit on our methodology. So we, just like with the pediatric guidelines, conduct a living systematic review every 6 months. So we do a new search every 6 months. Our small but mighty team rate all of the articles. We screen each article, we extract the data, and we evaluate each article for risk of bias. And I also want to acknowledge our over 40 experts from across North America who examine the literature with us, and they also participate in virtual meetings and online Delphi-like surveys to produce the recommendations. And they also help us create the resources for our website. And one unique aspect of our particular guidelines is we have a healthcare version, but we also have a patient version of the guidelines. So you can find that on our website, and we expect that the patient version will be updated likely in the early spring. Okay, so here's an image of the homepage for our guidelines. You can access the guidelines at concussionsontario.org. So that's concussions with an S. And we have a few different features on the website. We have the guideline sections. We have our transparent methodology. We have presentations and products. We have resources, which includes a pretty interesting FAQ section where we cover a lot of new emerging topics like nutrition and biofeedback. So I encourage you to check that out. And of course, we have the patient version. Okay, so like I said, we have 12 major sections in our guidelines, and it covers some broad areas like diagnosis, initial management, management of prolonged symptoms, but we also cover some specific symptoms like mental health, cognition, and headache. And I realize this is a sport conference, but we're still working with our experts on merging what we found in the literature and also what's in the Amsterdam consensus statement. So I can't show you those updated recommendations right now, but we expect that those recommendations will be on the website likely in late February, early March. So as an example, I thought I would go over the diagnosis section. Each of our sections start off with a couple introductory paragraphs. You can see in this section, we begin by going over the ACRM diagnostic criteria. Next, each section underneath the introductory paragraphs includes drop-downs for recommendations, tools and resources, and summary of evidence that supports each individual recommendation. So you can see here our first recommendation in the diagnosis section. Each recommendation usually comes with a drop-down for context, which isn't a recommendation, but it's just a little bit more elaboration to help people further understand the recommendation. And underneath that, we have levels of evidence for each major component of the recommendation. And lastly, I want to note that we have a little date stamp in the bottom right for each recommendation of when it was last updated. And underneath that, we have the tools and resources. You can see here, these are all resources for healthcare providers, but we also include in the patient version resources for patients. And here we have the summary of evidence. So you can see how each individual article is associated with each recommendation. And if you want to learn more about how we rate each article and rate a whole body of evidence, check out the strengths and limitations page in our methods. Okay, so that's it. I won't take up any more of your time. Please check out concussionsontario.org. And when you're on the website, we also have a neat feature where you can type in your email in the open-ended text box, and we can provide you with email updates whenever we update the website. So thank you very much.